Sure.
Hello, Assalamu alaikum. My name is Ali Shariar and my roll number is BP1550239. And the topic which is given to me for case study is photosensitivity, photo aging, and burns. And the subtopic for me is photo aging. So let's start the topic. So firstly, I'll let you know about the photo aging. Aging is a complex progressive process that lead to functional and aesthetic change in the skin. This process can result from both intrinsic, genetically determined, as well as extrinsic process, i.e. environmental factor. Photoaging or photoaging, also known as dermatolysis, is a term used for the characteristic change to skin induced by chronic UVA and UVB exposures. Photoaging involves a chronic inflammatory state induced by long-term exposure to sunlight, leading to hypermetabolic state of the skin. Photodamaged skin is characterized histologically by an accumulation of excessive quantities of thickened, degenerated, elastic connective tissue fiber. Photoaging is attributed to continuous long-term exposure to ultraviolet radiation of approximately 300 to 400 nm, either natural or synthetic. So, so now I'll let you know about the sign and symptom related to photoaging. So the first point for the sign and symptom is early symptom of photoaging. Dyspigmentation, the formation of wrinkles and other symptoms appear around region of skin commonly exposed to sun, mostly the eyes, mouth, and forehead. The lip may be affected. Spider webs on face and neck. Loss of color and fullness in lips. Symptoms of photoaging attributed to prolonged exposure to UV. Skin become leathery and laxity occur. Solar age spots appear on the face and hand. Possibly precancerous red and scaly spot appear. So after the sign and symptom, I'll let you know about the treatment of photoaging. The first treatment is primary preventations. In primary preventations, aim to reduce the risk factor before a disease or condition occur. Sun protection is the most effective form of primary prevention of photoaging. Secondary prevention refer to an early detection of disease potentially while still asymptomatic to allow positive interference to prevent delay. This includes the following: retinoid, antioxidant, oral supplement, estrogen growth factor, and cytokines. After the treatment, the heading which is come is case study. So in the case we have TB is a 38-year-old woman having 58 kg weight who has enjoyed many outdoor activities over the year. She lives in a moderate climate with hot sunny summer and cold winter. She feels that she appears older than the woman her age. Because of wrinkling and color changes of her skin, her facial color is somewhat yellowish in appearance, and the fine wrinkle at the corner of her eyes and mouth have become more obvious. She has noticed the formation of small brown spots mottling part of her face, hand, forearm. PB has a skin type 3, a clear complexion, and skin that is sensitive to soaps. Heavy cosmetic and perfume. What would be the treatment plan for her to manage her skin symptoms and condition? So let's start the soap. In soap, first we have subject in which the person have a weight 58 kg and his age is 38-year-old and the gender is female. So first we know about her history. No, no significant medical history. And in complaint we have skin yellowish, fine wrinkle at the corner of her eyes, small brown spots mottling part of her face, hand and forearm. After the subject we have objective for the photoaging. Treatment of symptoms such as skin yellowish, and the second point which we have appearance and the fine wrinkle at the corner of her eyes, formation of a small brown spot mottling part of her face, hand and forearm. And the assessment, we have yellowish appearance of yellowish skin and the fine wrinkle at the corner of her eyes, small brown spot mottling part of her face, hand and forearm. Patient is sensitive to soap, cosmetic, and heavy perfume, so they will show that the patient is suffering from the photoaging of the skin. And for the plan, we have the patient should recommend the use of this drug, tretinoin, which is available as cream 0.025% or 0.05 and 0.1%. And the second treatment which have adapalene is available as a 0.1% cream. And these both agents are effective in partially reversing some of the clinical and histological changes of photoaging by lessening fine wrinkle, motile pigmentation, and the tacticals, and the roughness associated with photoaged skin. And the second point, formation of new dermal collagen and vessel, reduction in the number and melanization of freckles, resorption of degenerated connective tissue fiber. After the plan, we will end this topic. Thank you.